have to explain this. Make it very simple. Okay. It's going on the live. Okay. So there are 3 common tests. I'm not going to talk about too much in this. First one is antigen test. Second one is antibody test. In the antibody test, there are 2 types. One is IgM, another one is IgG. This is not a medical school teaching, okay? So antigen, that's what we do in the hospital nowadays. We do that, the PCR test. The sensitivity is 30 to 80%. That means you might test in the early stage of disease. That will tell you negative. That is a false negative 20%, but that patient might be positive. And also if it is 30%, you can imagine 70% will be false negative. So that is a test we are doing at the moment all over the world. Now it has improved a little bit more. Anyway, that is one type we can find with the antigen. The second one is antibody test. There are 2 types. Make it simple. IgM, IgG. In other words, immediately after the infection, IgM will be present and for a long-term time, and then IgG will be present. End of the day, it doesn't matter. That's the thing. So they're going to test IgM and IgG, so that will tell you whether you had the infection or not. Now listen to this. If you had the infection, if you don't have the symptoms, do you have any reason to be at home? Back to work. That's a summary. Now, this has been announced. One of the research has been done. 20s and 30s, the young people. If you calculate the population, 4.2 million UK individuals, they are coming to this category. They can go. They don't need the test, basically. They can go, right? They can go and work, get some infection, spread that infection in the professional way, all right? That's the summary. Because they're going to get the infection very slight, right? So basically they maintain the hand washing and all, avoid as much as possible to give the elderly people or vulnerable people. At the same time, they infect each other and they will give some numbers, okay? We can test that by using the simple test, IgG or IgM, some point. It's cost around 4 or 5 pounds, simple test. It's like a pregnancy test, okay? So they will check whether they have been infected or not. Anyway, they will do their job. That is the first thing. Release the youth. That research has been done by one of the Warwick University. You can see that if there's a publication, you can read about that. Second one, the school closure. We were panicking. Why can't they close the school? We were shouting around and all. Unfortunately, there's no enough evidence. The school closing will reduce the transmission. Okay. There are 616 papers have been published. Now they did a, basically they analyzed this and they published another paper here. You can see that in the Lancet on 6th of 2020, 6th of April. According to this paper, there's no evidence for this. So why can't we reopen the school? Here we go. Next one, reopen the business. If the young people are running the business, why can't we reopen it? Okay. Our NHS system also kind of business. Obviously, every trust is functioning like a business. Already 1/3 of the NHS staff infected. So we will make sure. I'm sorry, 1 second. Anyway, we are recording, isn't it? We are recording.
We have to say
right. It's okay. Right. So we'll reopen the business and that will do that. And in the NHS system, 1/3 already have been infected. So we will make it 60. That's a good number. That's what the professor needs. Okay. So we'll get the infection. If we want to get the infection, what we have to do? We have to downgrade the FFP. N95 will protect you. That's not going to work. So you downgrade the FFP. Now you under, our protective things, That's what's going to happen. I'm going to ask you a simple question. In the NHS, 90 years old gentlemen not going to work in the NHS. NHS staff, most of them below 60 years old. Let them enjoy the infection, okay? Then they will be immunized and they can work. That is one way of thinking. Next one. This is what happened for our FFP. This is in Moscow. This is in China. This is in Doncaster recently, a couple of days ago. Okay, I don't know what happened in the real part. Right, it's coming bad. I like this FFB. Basically, this is what going to be the future. Sorry, I'm sorry, they're not FFB. Basically, PPE. Sorry about that. Our protective things. Okay, so I'm worried about, but unfortunately, this is the reality. We have to face it. This is the future. Remember that. Get the picture. Now, a couple of days ago, our health secretary announced that probably you would have watched the TV. We are going to introduce the tracing app. It's not a new thing. 5 years old. The Korean government introduced that. Now they are going to introduce that. But this is the interesting part. They are going to introduce, because they have to find out what is the percentage of the people have been infected. How can we find out that? They're going to introduce this, the kit. Probably that will be available in the GP practice. Probably you can buy it from the shop. Probably they can send by the post. So everybody will jump. I'm going to find out whether I'm infected or not. Whether I'm pregnant or not. They will be very excited. They will check it. They will enter all the information in this app. Probably they will come up with some solution. So the ministry will be able to find out, and the England Health Setup will be able to find out that how many people have been infected. Now this is the interesting part. If you enter the detail, if you say I'm positive, okay, do you have any symptoms? No, then back to work. If you say I'm negative, again they will ask the question, do you have any symptoms? No, then back to work. What's the problem? Okay, either way you're going to go back to work. There's no other reason for that. Now this is the very difficult slide for me to present. This is a really, really difficult one. I'm going to put the word in a very nice way. You have to get the idea what I'm trying to say. Okay, I'll do my best. I'm not a, English born and bred person. 75% of the healthcare budget are spent on long-term care, chronic conditions, and elderly care. And simply, our 75% of the money we are spending towards these vulnerable people. We have to shield them. Can we do that all the time? There will be some misfiring. So the budget, think about it. I'm not going to tell you anything more than that. Okay? But this COVID virus is a serial killer and the genius. So what will happen? What are they thinking about? I don't talk anything more than that. Okay? That's enough. If you're clever enough, you understand. So what's the plan? 60% of the population will get infected slowly. Maintain the curve flat, not above that line. That's the target. 60% of the NHS staff will get infected. Most of them are obviously under 60. So, and also in this situation, we will downgrade the PPE, give them a chance to get infection. Okay? I have a question. 20s and 30s, fine. Go around, no problem. More than 60, probably we have to shield them and protect them. So what's happening between the 40 and the 60? 40 years old and 60 years old. What's happening for them? Oh my God, I'm getting scared now. Young and healthy get infected. Reopen the school, get the children infected. Immunized, okay? Open the business, let it run. Shield the vulnerable people. I already mentioned in the previous slide. Come out of the lockdown situation. Back to semi-normal, not normal. That means still we follow the isolation if necessary, social distancing, and elbow touching, and washing the hand. All these things will continue. We are not going to be completely normal for some time until we find the vaccine and control this properly. There will be semi-normal situation. We have to be ready for the second wave. Remember that in 1918, the second wave was the biggest. So we have to prepare this. So that is our task now. So still, we're going to continue all of these. Why? Now there's argument, maybe another 5 minutes. there's another argument. Sometimes this will not work because sometimes people will argue with this situation. Why can't we, this will not work sometimes. What are the reasons for that? First thing is, normally we practice this in the vaccination situation, not in the natural infection situation. So that will not be very safe. That is one argument. The second one is, there is no antiviral treatment for this. That is the second one. The third one is, this infection more than once can infect, because there are some stories going on. South Korea, they found some infections. There is a reinfection. There's a talk going on. So in that case, this will not work again. What do you think about that? And also, some people are getting more affected than that. There are more than one strain. Basically 3 different strains have been identified. So how can we do that? So that other strain will come and target us. So what will happen for that? What about sometimes the vulnerable society will be affected more, sick. What is the solution for that? And also health and suddenly if you open these things, suddenly our hospital will be all burdened and we can't control this, that we will lose the control. There's an argument for that. We have to answer that question as well. That's why we are watching very carefully until the curve, now it's already starting to flatten and we can see the light end of the tunnel. So we have to wait and let the curve come down a bit. Then we can think about that. That's why we want to extend for another 2-3 weeks. This is not going to happen tomorrow. We can't take this lockdown very quickly. Probably we are thinking about, in my prediction, probably maybe 3 weeks, 4 weeks, maybe 1 month. This depends on how the curve is behaving. That's the situation. Get an idea. Next. Now I'm going to the next country, but next category of countries. I would say that India, Sri Lanka, Nepal. Prime Minister Modi announced that 21 days lockdown. That means everybody inside, curfew. Nobody can come outside. Okay, they are doing great. Up to now, this is the 14th of year. Nepal, there's no death. Sri Lanka, great, they are doing. Only 7 patient death, only 218 cases. They are developing country with very limited resources. Fantastic, I really appreciate. India, I think more than 1.2 billion people, only 10,000 cases, 358 death. Fantastic. Now there's a big question here. Initially, the Prime Minister announced that, okay, everybody locked in. People did not realize, probably they did not understand the language or something. There were hundreds of language. Then they used a different language, basically. That language is a universal language that worked very well. So everybody went inside. Now this is a situation. Some countries, they are struggling. The children, there's no food because everybody locked in. The poor people, they are struggling. This is there in all over the world, in the Asian countries. This is a key problem at this stage. Now my question is very simple. How long we can continue this? If you continue, can we continue for 1 year? Or do you have any exit strategy for this? Now, there's another big question. We are talking about herd immunity policy, and out of this herd immunity, we have a plan to come out. If you if you keep everyone inside and use the universal language, and there will not be any infection, yes, of course, that's a good thing, but at the same time, there will not be herd immunity. You are not giving any chance for that as well. So then what will happen for that? I don't know. I'm not expert in this. I can't answer this question. Just think about this. That is the purpose of this, the presentation. To think about what is the strategy. So how are we going to come out of this? How long we can continue, right? Current situation, this today's message, basically 160 districts have been identified in India as a red zone. The reason I'm talking about India, one of the worst affected country in 1918. 1918, India lost 15 million people, 6% of the all total population. Now you calculate what is the 6% of the total population now in India, that will be roughly around 70 million people. Okay, so that's why I mentioned this, the figure. You can think about the same situation in the Asian countries, similar situation. There's not much different. Now, so you have to think how long this will be. What is the strategy, and how much these countries testing, isolating, and contact trace? How successful is that? Any plan for the second wave? The first wave is not that problem. The second wave, if there are no herd immunity and all, the people will come out very quickly and everything will come, and this virus is a serial killer. Wait for that time, come.